Which viral disease shows a biphasic fever pattern? Option A measles, option B dengue, option C mumps, option D rubella. The correct answer is option B dengue. Dengue fever often present with a biphasic pattern, an initial high fever, short remission, and then a second fever spike. Which sign is commonly associated with Ebola virus infection? Option A rash, option B hemorrhage, option C jaundice, option D cough. The correct answer is option B hemorrhage. Ebola causes severe internal and external bleeding due to vascular damage and coagulopathy. Hemorrhage, enlargement of cervical lymph nodes with a sore throat suggest. Option A measles, option B Epstein-Barr virus infection, option C rubella, option D mumps. The correct answer is option B Epstein-Barr virus infection. Infectious mononucleosis from ABV typically causes cervical lymphadenopathy with sore throat and fatigue. Which viral infection leads to whitish vesicles on tonsils? Option hyperangina, option B measles, option C rubella, option D mumps. Coxsackie A virus causes herpangina characterized by small whitish vesicles on the tonsillar pillars. Rash is starting from trunk and spreading to limbs is seen in option A measles, option B chickenpox, option C rubella, option D dengue. The correct answer is option B chickenpox. In chickenpox, the rash begins on the trunk and face before spreading to limbs. Rash starting from trunk and spreading to limbs is seen in option B chickenpox. In chickenpox, the rash begins on the trunk. Painful oral ulcers recurring periodically suggest infection with option A HSV1 virus, herpes simplex virus type 1, option B rubella, option C mumps, option D measles. The correct answer is option A. Herpes simplex virus type 1 causes recurrent painful oral ulcers known as recurrent herpes labialis. A patient present with fever, rash, and joint pain most likely cause option A dengue, option B chikungunya, option C rubella, option D measles. The correct answer is option B chikungunya. Chikungunya virus infection causes fever with severe joint pain and rash lasting weeks. Which viral infection shows jaundice with severe itching? Option A hepatitis C, option mumps, option C measles, option D HIV. The correct answer is option A hepatitis C. Hepatitis C causes jaundice, fatigue, and intense itching due to bile accumulation. Viral infection shows jaundice with severe itching is option A hepatitis E. Enlarged posterior cervical lymph node with rash or seen in option A measles, option B rubella, option C chickenpox, option D mumps. The correct answer is option B rubella. Rubella typically present with post-auricular and posterior cervical lymphadenopathy along with a mild rash. Sudden high fever with rash and drop in platelet count indicates option A dengue, option B mumps, option C rubella, option D influenza. The correct answer is option A dengue. Dengue fever leads to thrombocytopenia, low platelet count, rash, and hemorrhagic tendencies. Sudden high fever with rash, drop in platelet is dengue. Which viral infection present with vesicles on lips and gums in children? Option A HSV1, option B rubella, option C measles, option D chickenpox. The correct answer is option A. Primary herpes simplex infection in children causes gingivostomatitis with vesicles and ulcers in the mouth. Chronic cough with weight loss in HIV patients suggest option A CME infection, option B tuberculosis secondary infection, option C measles, option D rubella. The correct answer is option B tuberculosis. Immunocompromised HIV patient commonly develop TB as an opportunistic infection. Which viral infection leads to painful blisters on the genital area? A. HSV2, option B. HPV, option C. Rubella, option D. Measles. The correct answer is option A. Herpes simplex virus type 2 causes recurrent painful vascular lesions on genital mucosa. Which viral infection present with petechial rash and shock? Option A. Dengue, hemorrhagic fever, option B. Measles, option C. Rubella, option D. Hepatitis. The correct answer is option A. In severe dengue, capillary leakage causes petechia, bleeding, and shock. Viral infection present with A patient develops swelling near ear, headache, and jaw pain. Likely cause. Option A mumps. Option B rubella. Option C measles. Option C dengue. The correct answer is option A mumps. Mumps infection of parotid gland leads to facial swelling and jaw pain. Mumps causes swelling near ear, headache, and jaw pain. Which viral disease may cause congenital cataracts in newborn? Option A rubella, option B Zika, option C CMV, option D measles. The correct answer is option A rubella. Congenital rubella syndrome causes cataracts, deafness, and heart defects in infants. Viral infection disease cause congenital cataracts is rubella. Cowdery type A inclusion bodies are characteristic of option A Herpes simplex virus, infection, option B measles, option C rubella, option D mumps. The correct answer is option A herpes simplex infection. HSV infection shows intranuclear cowdery type A inclusions on microscopic examination. Which viral infection may lead to hepatomegaly and splenomegaly? The correct answer, the options are option A EBV infection, option B measles, option C rubella, option D HIV. The correct answer is option A EBV infection. Infectious mononucleosis due to EBV causes enlargement of both liver and spleen. Epstein-Barr virus. A generalized rash followed by skin peeling is seen in option A staphylococcal scalded skin, option B measles, option C toxic shock, option D none of this. The correct answer is option D none of this. Generalized peeling desquamation is not a viral sense, it is a bacterial, thus not fits viral causes. The classic sign of influenza infection is option A coryza and sore throat, option B rash, option C jaundice, option D lymphadenopathy. The correct answer is option A coryza and sore throat. Influenza virus causes fever, cough, sore throat, and nasal discharge. Coryza, not rash. The classic sign of influenza is coryza. Which viral disease shows coplic spots before rash? Option A measles, option B rubella, option C mumps, option D chickenpox. The correct answer is option A measles. Coplic spots on the buccal mucosa appear in measles 1 to 2 days before the rash. Virus shows coplic spots before rash is measles. Swelling of lacrimal glands causing dry eyes and mouth is seen in option A HIV, option B mumps, option C rubella, option D influenza. The correct answer is option B mumps. Mumps can involve lacrimal and salivary glands causing eye dryness and discomfort. Mumps causes swelling of lacrimal glands. Which viral infection may show yellow eyes and tea-colored urine? Option A hepatitis A, option B measles, option C dengue, option D rubella. The correct answer is option A hepatitis A. Hepatitis A causes jaundice, dark urine, and fatigue due to liver inflammation. Hepatitis A causes tea-colored urine. A patient with HIV develops multiple purple skin nodules cause. Option A CME virus, Kaposi sarcoma, HHV8, option C rubella, option D measles. The correct answer is option B Kaposi sarcoma. Kaposi sarcoma caused by human herpes virus 8 appears. Which viral infection can lead to paralysis following fever? Option A poliovirus infection, option B mumps, option C measles, option D rubella. The correct answer is option A poliovirus infection. Poliovirus infects motor neurons in the spinal cord leading to flaccid paralysis after fever subsides. Poliovirus infection leads to paralysis with fever. Which viral infection causes recurrent vesicles on the lips during stress? Option A HSV1, option B rubella, option C mumps, option D measles. The correct answer is option A HSV1. Herpes simplex virus type 1 reactivates during stress or fever causing cold sores on the lip. HSV1 causes vesicles on the lips. A maculopapular rash beginning behind the ear is seen in option A measles, option B rubella, option C chickenpox, option D dengue. The correct answer is option A measles. Measles rash typically starts behind the ears and spread to face, trunk, and lips. Severe conjunctivitis with photophobia is characteristic of option A measles, option B mumps, option C rubella, option D dengue. The correct answer is option A measles. Measles virus cause eye dryness and photophobia due to inflammation of the conjunctiva. Measles causes severe conjunctivitis with photophobia. Which viral infection can cause deafness as a complication? Option A mumps, option B rubella, option C measles, option C dengue. The correct answer is option A mumps. Mumps can cause sensory neural hearing loss due to involvement of cochlear nerve. Mumps cause deafness as a complication. Fever with rash and tender lymph nodes suggest option A rubella, option B measles, option C dengue, option D chickenpox. The correct answer is option A rubella. Rubella infection present with mild fever, rash and tender post-auricular or occipital lymphadenopathy. Fever with rash and tender lymph nodes suggest rubella. Which sign indicates severe dehydration in rotavirus infection? Option A dry mouth and sunken eyes. Option B rash. Option C parotid swelling. Option D jaundice. The correct answer is option A dry mouth and sunken eyes. Rotavirus causes water diarrhea leading to dehydration reflecting by dry mucosa and sunken eyes. A pregnant woman infected with rubella in early pregnancy may give birth to an infant with option A microcephaly, option B cataract, option C heart defect, option D all the above. The correct answer is option D all the above. Congenital rubella syndrome includes microcephaly, cataract, and congenital heart disease. Which viral disease causes Ol's eye inclusion in nucleus? Option A CMV infection, option B HSV infection, option C measles, option D mumps. The correct answer is option A CMV infection. Cytomegalovirus produces large intranuclear inclusions called Ol's eye bodies on histology. CMV infection causes Ol's eye. A child presents with red eyes, runny nose and rash likely disease. Option A measles, option B rubella, option C mumps, option D chickenpox. The correct answer is option A measles. The classic trait of cough, coryza and conjunctivitis with rash indicates measles. Which sign is a characteristic of hepatitis C virus infection? Option A chronic liver disease, option B acute jaundice, option C rash, option C parotitis. The correct answer is option A chronic liver disease. Hepatitis C often causes chronic infection leading to liver fibrosis and cirrhosis rather than acute jaundice. Characteristic of hepatitis C is chronic liver disease. Sudden onset of fever with joint stiffness and rash is seen in option A chikungunya, option B dengue, option C measles, option D rubella. The correct answer is option A chikungunya. Chikungunya virus causes severe joint pain and swelling, often with a rash. Sudden onset of fever with joint stiffness is called and rash is called chikungunya. Painful blisters along with the genital area appear repeatedly. Option A HSV 2, option B HPV, option C rubella, option D mumps. The correct answer is option A. Herpes simplex virus type 2 causes recurrent and genital herpes with painful vesicular eruptions. Which sign is common in both measles and rubella? Option A maculopapular rash, option B Koplik spots, option C hemorrhage, option D jaundice. The correct answer is option A. Both infections cause maculopapular rashes, but Koplik spots are specific to measles. Which sign is common in both measles and rubella? Which viral infection may lead to swelling and pain in the ovaries? Option A mumps, option B rubella, option C measles, option D chickenpox. The correct answer is option A mumps. Mumps can cause oophorytis, inflammation of ovaries in post-pubertal females. Which viral infection may cause swelling and pain in ovaries? The correct Which viral infection is commonly associated with jaundice and malaise? Option A hepatitis B, option B rubella, option C mumps, option D measles. The correct answer is option A hepatitis A. Hepatitis A virus infects liver cells leading to jaundice, fatigue and loss of appetite. Hepatitis A virus associated with jaundice and malaise. A vascular rash limited to one side of face and body indicates option A herpes zoster, option B chickenpox, option C rubella, option D measles. The correct answer is option A herpes zoster. Herpes zoster affects sensory nerves and causes rash restricted to one side dermatomal pattern. A ground glass appearance in liver biopsy is seen in option A hepatitis B infection, option B hepatitis A, option C measles, option D rubella. The correct answer is option A hepatitis B infection. Accumulation of hepatitis B surface antigen in hepatocytes gives a ground glass microscopic appearance in HBV infection. Pain in jaw while eating and swollen cheeks in a child indicates. Option A mumps, option B measles, option C rubella, option D dengue. The correct answer is option A mumps. Mumps infect salivary glands causing painful parotid enlargement worsened by chewing. Which viral infection presents with rash, fever, and bleeding gums? Option A dengue, hemorrhagic fever. Option B measles. Option C rubella. Option D chickenpox. The correct answer is option A dengue, hemorrhagic fever. Dengue hemorrhagic fever causes increased capillary permeability and bleeding manifestation. Dengue hemorrhagic fever present with rash, fever, and bleeding gums. Rash on palms and soles is seen in which viral disease? Option A hand, foot, and mouth disease. Option B measles. Option C rubella. Option D mumps. The correct answer is option A hand, foot, and mouth disease. Coxsackie virus causes vascular rash on palms, soles, and oral mucosa in children. Generalized itching without rash in a viral infection suggests option A hepatitis, option B measles, option C mumps, option D rubella. The correct answer is option A hepatitis. Hepatitis causes cholestasis and bile retention leading to itching even before jaundice appears. Hepatitis causes generalized itching without rash. Swollen glands behind the ear indicates option A rubella, option B mumps, option C measles, option D influenza. The correct answer is option A rubella. Rubella causes post-auricular and occipital lymph node enlargement early in the illness. Swollen glands behind the ears indicates rubella. Breakbone fever with severe muscle and bone pain is due to option A dengue, option B chikungunya, option C rubella, option D measles. The correct answer is option A dengue. Dengue is also called breakbone fever due to intense muscle, joint, and bone pain. Dengue is also called breakbone fever. Which viral disease common leads to jaundice in pregnancy? Option A hepatitis C, option B hepatitis A, option C rubella, option D mumps. The correct answer is option A hepatitis E. Hepatitis C infection particularly severe in pregnant women and often causes acute liver failure. Hepatitis E infection can see in the pregnant woman. A viral disease showing subcutaneous bleeding, shock, and high fatality is option A Ebola, option B rubella, option C mumps, option D measles. The correct answer is option A. Ebola virus infection presents with high fever, bleeding under the skin, organ failure, and high mortality. Thank you.